Hello, my name is Anayah Ayoka. I am a certified nurse midwife and women's health nurse practitioner. As a senior medical educator in Bayer Medical Affairs and Women's Healthcare, I'm grateful for the chance to speak with you today about your birth control options. My goal is to give you clear, trustworthy information so you can feel confident discussing your choices further with your healthcare provider. Please remember that this presentation is for education and does not present personal medical advice. To start, let's briefly talk about how the menstrual cycle works. Each month, your body prepares for a possible pregnancy by building up the lining of the uterus. Around the middle of the cycle, usually around day 14 to 16 for most people, an egg is released. This is called ovulation. If the egg is not fertilized, the lining is shed as your period and the cycle begins all over again. Understanding this process helps explain how different birth control may work to prevent pregnancy. During that menstrual cycle that we just described, once the egg is released around that time period, if sperm are present, they may cause fertilization of the egg, leading to pregnancy. Birth control methods are designed to safely interrupt this process, either by preventing ovulation, blocking sperm, or stopping fertilization from occurring. Each method has its own approach, and I'll walk you through them during this brief presentation. There are many safe and effective birth control options today, including permanent sterilization. This is also called tubal ligation, or known as having one's tubes tied. It's performed by a surgeon and is around 99% effective at preventing pregnancy. It works by preventing sperm from reaching the egg. It does not have long-term effects to one's monthly bleeding and does not provide protection against sexually transmitted infections. Throughout this talk, I will continue to review the categories of contraception, including LARCs or long-acting reversible contraception, injectable progestin, short-acting hormonal methods, barrier methods, as well as other forms of contraception. For each category, I'll be sure to provide you with a sense of the efficacy or how successful this method is at preventing pregnancy, how it works, whether or not it may affect your monthly bleeding, and whether or not it protects against sexually transmitted infections. You'll also notice that this presentation is designed to discuss the most effective methods earlier and to continue on by the degree of efficacy. Let's get started. Long-acting reversible contraceptive methods prevent pregnancy over the course of several years and are called reversible because they allow a person to return to their baseline chances of becoming pregnant after removal. The hormonal arm implant or implantable rod is a small flexible rod placed just under the skin of your upper arm by a healthcare provider. It works by steadily releasing a hormone called progestin, which prevents ovulation and thickens cervical mucus to block sperm. It is inserted and removed by a healthcare provider and can last for up to 3 years of providing contraceptive protection. It is about 99% effective at preventing pregnancy, and many people experience lighter or irregular periods, and some may stop having periods altogether. This implant does not provide protection against sexually transmitted infections, and you can have it removed at any time you wish by seeing your healthcare provider for a removal appointment. Intrauterine devices, or IUDs, are placed in the uterus, as the name describes, and there are two main types. There are hormonal IUDs, which contain the hormone progestin, and there are non-hormonal IUDs. IUDs work by acting locally in the uterus with very little systemic effect. Both types of IUDs are placed in the uterus by a trained healthcare provider and are highly effective at preventing pregnancy. Let's discuss hormonal IUDs first. They release progestin into the uterine environment, which thickens cervical mucus, preventing sperm from reaching and fertilizing the egg. They may also interfere with sperm movement and with sperm function. Non-hormonal IUDs, which are made of copper, use copper to create an environment that impairs sperm movement and prevents fertilization. They are inserted and removed by a healthcare provider. Hormonal IUDs can last from 3 to 8 years, depending on the IUD that's chosen, while the copper IUD can last up to 10 years. Both types have about a 99% efficacy rate at preventing pregnancy. Hormonal IUDs often lead to lighter or less frequent periods, and some people may stop having monthly bleeding altogether. Copper IUDs may cause heavier or longer periods, especially in the first few months. Neither type of IUD will prevent sexually transmitted infections, and you can have an IUD removed at any time you wish, or if you desire to become pregnant, which does allow you to return to your baseline state of fertility and for your periods to return to what would be the normal for you. With the contraceptive injection, you would also have a very reliable option for contraception. It works by preventing ovulation with the hormone progestin, and it is given by a shot every 3 months at your doctor's office or your provider's office by the healthcare provider or nurse. It is effective at preventing pregnancy about 94% of the time. As far as bleeding, some people may experience irregular bleeding or have their monthly bleeding stop while using this form of contraception. It does not provide protection against STIs, and of note, a person will return to their own fertility after stopping, though it may take several months. Short-acting hormonal methods include birth control pills, the patch, and the vaginal ring. They work by preventing ovulation, and they may also thicken cervical mucus to block sperm. Pills are taken daily, the patch is changed weekly, and the ring is worn in place in the vagina for 3 weeks, then removed for 1 week. As far as efficacy, they are about 91% effective at preventing pregnancy with typical use. These methods can help regulate, lighten, or even stop periods while the method is being used. They do not protect against STIs. And as far as flexibility, a person can stop this method at any time they choose because it is the patient themselves who administers or gives themselves that method directly. Barrier methods include condoms, diaphragms, sponges, and cervical caps, often used with spermicide. They work by physically blocking sperm from reaching the egg. Any of these barrier methods is put in place prior to sexual intercourse, and some of them must stay in place for at least 6 hours. You'll be sure to follow your healthcare provider's instructions or the instructions on the packaging to know for which ones that is appropriate. As far as effectiveness, that's going to vary. External condoms, for example, are about 87% effective, while internal condoms prevent pregnancy about 79% of the time, based on how they are typically used. How well a diaphragm, sponge, or cervical cap may do at preventing pregnancy will also vary, as whether or not a person has given birth vaginally before may affect the efficacy of those methods. There is no effect to a person's monthly bleeding or period with the barrier method of contraception. And condoms are known as the only method to protect against sexually transmitted infections. Please note that some spermicides may cause vaginal or rectal irritation and may increase the risk of HIV if used with a partner who has that infection. Now, as far as other methods that may include withdrawal or what is sometimes known as the pull-out method, where the penis is removed from the vagina prior to ejaculation, and it works by preventing sperm from entering the vagina. To use this, it does require careful timing, self-awareness, self-control, and communication between the participants, right? And it is about 78% effective at preventing pregnancy, meaning that about 22% of 22 people who use this method out of every 100 each year will become pregnant. This method has no effect to the period or monthly bleeding and will not protect against STIs. Fertility awareness method involves tracking the cycle to avoid unprotected intercourse during fertile days. It works by having the person monitor changes to the body, including changes to the cervical fluid, or sometimes called cervical mucus, Body temperature is tracked daily using a special thermometer, while also paying attention to the days of the cycle so that a person can identify that fertile window when they may be most likely to become pregnant. This method also requires daily tracking, self-awareness, education, and a commitment to keep it going every single day, because it is that data collection that helps the person to know when to avoid unprotected intercourse. As far as efficacy, it is about 76% effective at preventing pregnancy. So about 24 out of 100 people every year will become pregnant when using this method. It has no effect to the period or monthly bleeding and will not protect against sexually transmitted infections. Lastly, spermicide alone is a chemical that kills sperm and is often used with barrier methods. It works by killing sperm before they reach the egg. With use of spermicide alone is inserted before sex. Of course, as I mentioned before, it can be used with a diaphragm, sponge, or cervical cap. It is about 72% effective at preventing pregnancy when used alone, and it will have no effect to the period as it does not affect the hormonal cycle. And it also does not protect against STIs, but also I will remind you that it may increase the risk of a person having HIV transmission if they are having sexual intercourse with an infected partner. Thank you for your attention. And we really want you to remember that the best birth control method is the one that fits your health, your values, and your life. So please talk with your healthcare provider to find the option that's best for you.